I am ENT specialist Dr. Sagar Rajpur from Nashik, Maharashtra. Video of today is regarding how to get rid of sinus infection in 24 hours. Yes, of course, if your sinus infection is only since 1 or 2 days and you are suffering from just for the first time you are suffering from it, then you follow up our instructions and within 1 or 2 days you will become totally okay. Within 24 hours you can be totally okay. There is nothing big thing in that. But you only imagine if suppose there is any patient who is suffering from sinus problem since the last 5 years and he has got the cold problem for 5 days in a week or 3 days in a week, he gets okay with medicines, and then again the same problem comes after 15 days and remains for 5 days, and this thing is happening since the last 5 years. Is it possible to cure him just with medicines? Yes, of course, he requires a nasal endoscopy and a CT scan, which is advised by qualified and experienced ENT specialist doctor. Once the patient goes there, first a nasal endoscopy is done and then a CT scan, PNS is advised. PNS is the paranasal sinuses CT scan, which covers the entire nasal cavity, the hollow spaces sinuses and the posterior aspect of your nose, which opens in the oropharynx, that is also covered in that. Okay, suppose if any patient is having blockage of this maxillary sinuses, these are hollow spaces which drain in the lateral wall of the nose. If the drainage is slow, if the drainage is blocked, then what happens, the other sinuses, the ethmoid sinus and frontal sinus of each side, they also open in the same point. So all this drainage of all the ethmoid and frontal sinuses as well as the maxillary sinus gets blocked and the patient complains of sinusitis. Then in this case, by endoscopic surgery, this sinuses opening has to be widened. Okay, so everything is done by endoscope. It is a stitchless surgery. The appearance of nose from outside remains the same as it is. It doesn't change, but the problem of the patient is cured. There is no incision from the external side. If there is deviated nasal septum, okay, then that is also corrected. Deviated nasal septum in the sense that the septum is deviated to so much extent that it is causing problems to the patient, like nasal obstruction, sinus blocking problems and all. Okay, because only in 10% of the population the nasal septum is straight. In 90% it is crooked only. But in which patients do we do surgery? We do surgery only in those patients in which the deviation is to such an extent that it is causing problems to the patient. Otherwise we don't advise septoplasty to any patient. Okay, so this video is issued in public interest, so you share this with maximum number of people. You subscribe to this channel because many interesting videos are going to come afterwards. You also like this. We will also wait for your comments, because depending on your comments we make the next video. Okay, and if you want to ask any question, we can make a separate video on that. So we would eagerly wait for your comments. Okay, this is very important for us. If there is any nasal polyp, then that is also removed endoscopically. Now this is your nasal septum and this is the lateral nasal wall on each side. The septum is in between. From the nasal wall, lateral nasal wall, there are terminate, inferior terminate, middle terminate and superior terminate. So in some patients, what happens that the middle terminate becomes enlarged. That is not good for the health of patient. We call it concapulosa. Then by surgery we trim it, we reduce the dimensions. If there is a paradoxically cut middle terminate, which is seen clearly in the CT scan, you remove the lateral portion of the terminate. We remove only the lateral part, not the entire terminate, because the mucous secretion which is secreted by the sinuses, by the mucosa of the terminates, is responsible for making the incoming air moist, and moist air is necessary for the lungs. You must have seen patients suffering from deviated nasal septum. They breathe through their mouth. Patients suffering from sinus problem, they breathe through their mouth. Is it natural way of breathing? No. From the nose, if the air is entering inside, there are hairs at the entry. They block the dust. Okay, so this is a natural filter, and the mucous secretion inside makes the incoming air moist. It increases the relative humidity of the air which is entering inside, and moist air is required for the good health of the lungs. Otherwise patient face problems. They don't come immediately. Bronchial asthma, pneumonia and all these things, they happen after long period of time, so people don't pay attention to it. So it is natural to breathe through the nose only and not through the mouth. Okay. Suppose on the CT scan only allergic finding is seen, nothing is seen, deviated septum is not there, sinus problem is not there, then we advise only medicines and restrictions. We don't advise surgery without any reason. So first you should consult your ENT specialist doctor. If any patient requires consulting from us, online consulting or actual visit to our clinic, you can go through the clinic address which is given in our description. You can take appointment and meet us. Personally meeting in our clinic is always better. We also do online consultation, there is no problem, but if you come personally it is always much better. Going through this video is not just sufficient at all. It is necessary to click on the link given in the description, so that you can know the subject in detail. In the last video we had mentioned that some people directly go to Google and they treat themselves as if they are doctors. Now you only imagine if someone does like this. Okay, is it necessary for someone to spend 4.5 years for doing MBBS or 3 years for doing specialization? There is some thing involved in it. So you should not do the things by yourself. You can land up in problems. Okay, without any reason, don't take any things, any medicines which are advised by people who are not doctors. Don't keep on doing like this. Okay, sinus surgery is not successful, septoplasty surgery is not successful. These are the misconceptions in the minds of people. Okay, if you are going to qualified people, experienced ENT surgeons, your surgery will be successful. There is no doubt regarding it. Okay, if you don't take surgery, then if you are suffering from sinusitis and don't take any treatment at all, that is what I say, then you can end up in problems. After a long duration, the nasal infection trickles into the throat and goes into the lungs. So patient can have pneumonia, asthma, all these lung problems. So patient needs to get into ICU if he has got pneumonia. Okay, infection goes to the middle ear, to the eustachian tube after coming back into the throat. So patient gets hearing problems. After some time there can be perforation of the tympanic membrane, ear discharge can come, tympanic membrane perforation can be there, so he can require tympanoplasty surgery of the eardrum. Okay, there was one patient in my career I had seen. For 5 years he had not taken any treatment at all. He had not taken any treatment. So what happened, that he landed up into severe sinusitis to such an extent that the infection spread to the orbit. Because as you see, besides the sinuses, your orbit is there. So his upper eyelid and lower eyelid was so much swollen that he was not even able to open his eye. His vision was restricted. Then the ophthalmic surgeon had to drain infection from the orbit. ENT surgeon had to clear the sinuses. So all this double triple problem comes. Okay, if you are having your four-wheeler car and your brake plates are not in good condition, okay, then you have to replace it. Because what happens, you drive your car to such an extent and there is further deterioration in those brake plates, then there is trotter above it. Okay, so if the trotter is spoiled, then you have to keep your car on the road and keep it like that. Okay, so for 3 to 4 days you cannot travel. So that is a big problem. So everything, any problem should be corrected in time only. Then only it makes sense. Otherwise it is of no use. So this is all. These are all the important things regarding sinus problems. Okay, patient can have cough, the thick discharge that comes from the nose and enters in the throat. Patient has cough from that. Okay, chronic cough can result. So we expect that you should share, like and subscribe to this channel. Many important videos are coming. You will get notifications regarding those. Okay, thank you very much.